As for why we've seen such a fluctuation in the numbers, yesterday we heard from infectious disease expert Ben Cowling at the University of Hong Kong. He was speaking to journalists and he said that, there was a big jump in the number of cases seen yesterday, possibly because authorities were clearing a backlog of cases that have now been classified under this new, diagnostic definition. And he said that, and we also saw that in Chinese media on Tuesday, Provincial Health Commission released the first figure of the clinically diagnosed cases, and that came up to over 10,500 cases, but that wasn't added to the newly confirmed cases. So yesterday was the first time we saw these clinically diagnosed cases being added in. As for whether this new methodology is good or bad, I think experts are saying that it is good because it does help paint a more accurate picture of the spread of the infection. This could help authorities in containing the spread and addressing the situation better.
To detect it earlier.
Absolutely. Also because we know that in hard-hit areas like Hubei, they probably have the medical facilities really, really stretched. And so, for example, when we're talking about the previous method of only relying on lab testing, the nucleic acid test, one example that the experts gave was, for example, if you have a lab that can only do a maximum of 10 tests per day, in the numbers, in the statistics, you will only see 10 confirmed cases. But now that doctors are given more discretion to make this clinical diagnosis, we may be able to have a better understanding of the situation on the ground. Though we have to note that this method is only being applied to Hubei province.